how can somebody who's sitting at home assess the health of their pelvic floor?
When we're talking about general health, just look at your habits. Look at, oh, am I having like pain with sex, with deeper penetration? Or am I, going to the bathroom multiple times before going to sleep and I feel like I have to go, but nothing's coming out? Kind of just evaluate your habits and then use some of the tips that we talked about to adjust. But I think if you really want to see how your pelvic floor muscles are working, you can self-evaluate them without having to see a therapist. So you can take a mirror and you can, where I really tell you to focus is what's called the perineum. So it's the area between underneath the scrotum and the anal opening in males, or between the vaginal opening and the anal opening in females. And that's the grand central station of your pelvic floor muscles. Like that's where the pelvic floor muscles connect and they lift your pelvic floor up and they push down when you're relaxing. So take a mirror, and when you say, okay, I'm going to try to contract my pelvic floor, do a Kegel, you should see that lift up. And then when you say, okay, I'm trying to bear down like I'm having a bowel movement, you should see that push towards your feet. You can also use your hand. So you can sit on your hand, just the flat base of your fingers, nice and upright, and try that contraction. And the muscle should lift away from your hand. If you push or bear down, you should feel the muscles push into your hand. And if you want to get really spicy, you can internally evaluate. In the female body, you can insert a finger into the vagina, or the male body, you can insert a finger into the anal opening and squeeze. Do you feel the muscles tightening? Push out or bear down. Do you feel the muscles kind of rolling out and relaxing? So there's a lot of ways that you can kind of just self-assess. Am I doing a contraction properly, and am I bulging and relaxing the muscle properly?
Absolutely. And if inserting a finger hurts, that's a good sign that there's probably a problem. Like it shouldn't be painful.
Right.
I mean, sometimes inserting a finger in the anus can be slightly uncomfortable just when you're passing the sphincter, but it shouldn't be painful.
Correct. I mean, if I have my finger in someone's anal opening during an exam, I'm like, it should feel like you have a finger in your anal opening, but it shouldn't be like causing you to be so uncomfortable and in searing pain or discomfort. That's usually a sign that there's dysfunction, at least of the muscles in some capacity.
Right. So if you're someone who's getting pelvic exams as a female or rectal exams as a male, and it's always been painful for you,
yeah,
talk to your doctor, see a pelvic floor physical therapist, do a self-assessment. I bet you that there's some pelvic floor dysfunction there.
No, absolutely. And I mean, so many people have this, it's like, to your point, we live in a high stress society. So we're not always relaxing when we need to be relaxing.
Yeah. So it's interesting. We do cystoscopies in urology, right? So we look through the urethra, and for women, it's usually quite not a big issue. But for men, and same thing with some women, when they have tension in their pelvic floor, that tension affects their urethral sphincter. And so when the scope passes that sphincter, for some people, everyone feels a little bit of discomfort. I will say that for sure. But for some people, it is miserably painful. Those are the people where we know unequivocally, I don't have to do further examination. If I'm doing cystoscopy for something else and I see that, I can tell you they have pelvic floor dysfunction. Yeah. And so again, if you're someone who's like hypersensitive during these examinations, there's probably a physiologic reason for that.
There is. And it's a little bit of the chicken or the egg too, because I'm like, we need to treat the pelvic floor issue. And I have a lot of people coming in for that, because you can walk right into a PT office in every state and say, hey, I want an eval for my pelvic floor. But if they haven't ruled out other pathologies or larger dysfunctions, like a stricture or a prostate issue or, a GI issue or anything, it's like we need to make sure that we're clearing that and then saying, okay, now let's also address the pelvic floor while we're treating that, or it's not something larger and the pelvic floor is really the component that needs focus.
Absolutely. It's always sort of, it's never just one thing.
Right. It's like pieces of the puzzle we really have to put together.
Right. What about dietary issues? Are there certain dietary changes people should make that will allow for optimal pelvic floor health?
Right now, protein is all the rage. So we talk about building skeletal muscle and making sure that we're getting adequate protein. And your pelvic floor muscles are skeletal muscles. So they can hypertrophy and you can, load them and build muscle strength just through that. I don't think that you need to overload your protein. I think most of us are, with all that the information we're getting, are likely getting an adequate amount. And these aren't huge muscles. They're not like big quads, So, but making sure that you're getting enough protein to build skeletal muscle if you're actively working on strengthening. But I would say the biggest thing about diet is how it affects your bladder and your bowels. And I talk so much about peeing or pooping because I'm like, if you're doing it wrong, you're going to have pelvic floor dysfunction. Typically avoiding constipated foods if constipating foods is what I recommend. So a lot of processed foods can cause constipation, too many grains and pastas, too much dairy. The research is actually mixed on dairy, but if I have somebody coming in and they're drinking 3 glasses of milk and eating a lot of cheese, I'm going to be like, let's cut back on the dairy. So some of those things that can be really constipating, I would say you also want to think about things that have a lot of fiber that can help soften your stool. And I'm not saying like a fiber bar. I'm talking about like real fruits and sweet potatoes and mangoes and, grains.
Seeds, yeah.
Chia seeds, things that can help soften the stool naturally versus having to, get fiber in a bar. And then making sure that you're drinking enough water. We need that water to help flush our bladders, to help, make our stool soft. So a combination of all those things is, I think, really important.
Yeah, absolutely. And I would add that there are certain things that irritate the bladder too. And they're typically very individualized. So not everyone has bladder irritation from the same things. We know that caffeine and alcohol are probably, I wouldn't say universal, but very common bladder irritants. And then the other ones like spicy foods, artificial sweeteners, citrusy fruits and juices, tomato-based products, they can irritate some people. So sometimes it's just like taking note, like, hey, taking a diary, being like, what did I drink? Did I have an urge to pee more strongly? Did I have to rush to the bathroom after drinking some orange juice or having tomato sauce in my pasta? Like just kind of like taking note and then maybe omitting one thing at a time to just see what makes a difference. I think it makes a huge difference for a lot of people.
You're so right. I mean, when I travel with my mom, every time she has grapefruit juice, she's like, oh, I got to go to the bathroom. And I'm like, well, stop having the grapefruit juice when we travel,
Yeah. Or just know that that's going to happen.
Or know it's going to happen and make sure the bathroom's accessible. And the other things I tell people is to sip water with it. Like that will help kind of dilute those more kind of irritating foods that could bother your bladder. Oftentimes, I think when we're worried about leaking or peeing too frequently, we don't drink enough water. We think that that's like dehydrating ourselves is going to be what helps when it can actually cause more bladder irritation or even incontinence.
Absolutely. That can absolutely cause bladder irritation. And so what I tell patients is aim for lemonade yellow urine, right? Like you don't want it to be dark yellow. I don't ideally love clear urine because we're in a hyperhydrated society. Everyone's walking around with a huge Stanley cup and drinking 4 of them a day. And like at some point, you're causing just more urinary frequency with very little benefit.
Right.
So I think it's really a matter of like get to the color urine and the amount of fluid that makes you feel good. Our body's so smart, right?
I know.
If you're thirsty, like I'm thirsty. Okay, I'll drink some water. It's very simple. Obviously people will say, okay, when you get thirsty, you're a little behind. But I think ultimately like, okay, is it going to make a huge difference? Maybe if you're like performing in an Olympic sport that day, you should be really extra hydrated. But like for the most part, most people are not going to notice major differences.
Right. And, these are such simple things. And when you think about like, oh, I'm thirsty, I think sometimes we're not even pausing to tune in. We're just go, go, go. Like I know I'll eat a granola bar and a mozzarella cheese stick in the car. And then I'm like, I'll get to 2 o'clock. I'm like, I haven't even drank water yet, So it's really kind of just pausing, slowing down, just kind of taking an inventory of what is going on with our body and how our day is running. And we're so far from that, unfortunately, in our day-to-day lives. I think especially as parents or you're working parents or moms so I really am like, let's just take a beat. And sometimes that just helps us tune in a little bit more.
So let's talk about how your pelvic floor works during the sexual response cycle. So during desire, arousal, orgasm, and after.
So your pelvic floor muscles have glands on the inside of the vulva and externally, and they actually are responsible for lubrication in the area. So when you've got good estrogen levels, you've got good fluid, as you're getting aroused, you're going to get more lubrication in that area of the vulva. And you're also going to get better blood flow. So with arousal comes blood flow to the pelvic floor muscles. As you are starting to get more aroused, your pelvic floor muscles start to kind of get heightened. They start contracting. And when you hit climax, you get a wave or a contraction and relaxation of those superficial pelvic floor muscles. So people are often like, how does an orgasm relate to your pelvic floor? I'm like, an orgasm is pelvic floor muscle contractions. And so it's really important that you have optimal pelvic floor muscle function to have orgasms, to have strong orgasms, consistent orgasms, and pain-free orgasms. When we talk about the male body, there are no muscles in the penis, but there's a lot of connective tissue and arterial supply and veins and arteries. And so blood flows into the penis with arousal, and your pelvic floor muscles in males contract to maintain that blood flow. And that's what helps maintain erections. What we see in males a lot, if those muscles are weak, if they are too tense or they're not coordinated well, you have a hard time maintaining erections. You may even have premature ejaculation, or you may have painful erections. So you need optimal pelvic floor function to have great sexual function as well.
Yeah, and there's actually an abundance of data showing that pelvic floor exercises can help with male sexual function, whether it's erectile dysfunction or premature ejaculation. And of course, urinary incontinence, particularly in men who've had prostatectomy or surgery to remove their prostate.
Yeah, I mean, I'm a huge fan of doing like prehab before men have a prostatectomy and post surgical therapy, because these muscles are affected, their nerves are affected. So we need to retrain them. Just like if you have an ACL tear in your knee, you get therapy before and you get therapy after. And I really think when it comes to pelvic surgeries for males and females, we really should have that as kind of part of the model, because we know that it's going to optimize function.
Absolutely. Do you think that pelvic floor function affects pleasure?
I do. If you're experiencing pain with something, one, you're going to want to avoid it. And two, it's hard to relax and enjoy. Like if I'm putting my hand on a hot burner and that hurts and it's painful, that's not pleasure to me. And when we experience pain with something, we can actually develop trauma even from that. We can start to kind of really anticipate the pain before it's even happening, and our bodies are responding in this upregulated state. And then we avoid it, and there's more anxiety, and that anxiety causes tension, and that tension causes pain. So I think that pain absolutely affects pleasure. I've seen this in all genders, but particularly with, females in my practice that have painful intercourse. They don't want to have it, and they're quite traumatized either from a gynecological exam or a sexual, response where it's been so painful for them that even just the thought of it can activate their pelvic floor muscles and start muscle guarding. So in my very functional pelvic floor field, I really do think that pain and pleasure have a hard time coexisting for most people. There's always some who like, painful sex, or they want pain and that's pleasurable for them. But I would say for most people, that's not the case.
But typically in those circumstances, they can control the pain.
Correct.
So this is different. But I meant more so if someone doesn't have dysfunction, right? They're normally functioning, but they want to get better function. Is there value in those cases to really focusing in on pelvic floor strengthening to get better pleasure?
Yeah, absolutely. I think if you want stronger pelvic floor muscles for better tone in your vagina, for more pleasurable sex, for stronger orgasms, for male bodies, if you want to maintain longer erections, stronger orgasms. I mean, these are muscles, and you can build them up in hypertrophy with exercise to have better performance in those arenas. Absolutely.
Yeah. What are Kegel exercises?
Kegel exercises are pelvic floor contractions where you squeeze and lift this basket of muscle. So it's closing the urinary and anal sphincters, it's closing the vagina in females and lifting that basket of muscles. They're named Kegel after a gynecologist, Arnold Kegel, who was doing a study testing the pelvic floor muscle contraction strength in postpartum females with a device inserted in the vagina. And he called this contraction Kegels because he was asking them to squeeze their vaginas around the device. So he named them after himself, essentially. So we still call them that, but they're pelvic floor muscle contractions, which is an exercise you can use to strengthen the pelvic floor muscles.
If you guys enjoyed this clip from the episode of the Rena Malik MD podcast, make sure to check out the full episode with Dr. Reardon right here.